Hi guys, and welcome to week number 6. So this week we have 2 chapters that we are focusing on, and those two chapters will deal with nephrology, or your kidney functions. So those 2 chapters are going to be chapter 2, page 29, and chapter 31. So let's go ahead and start our overview of those 2 chapters. Now, chapter 2 was talking about and dealing with the different types of medical practices available. This was a chapter that you had to read in your first course, your fundamentals course. So when we talk about this, we're actually just touching on page 29, which is going to be dealing with a specialty that's going to work on the topic of nephrology. Now, it's important that you know most of the specialties do allow medical assistants to work within their offices, and most job opportunities for medical assistants are going to be in an outpatient setting. But that could change with the rapid shift of healthcare. We all know that it changes very rapidly. So this week we're focusing on nephrology. And a nephrologist is the provider that will specialize in diseases of the kidney and kidney disorders. Now, nephrologists are skilled in both the medical and surgical treatment of the kidneys, which will include dialysis. So if you can think back to last week in Module 5 when we talked about neurology, you had a neurologist and a neurosurgeon. One did just the medical part of it and the other did the surgical. For nephrologists, they can do both aspects. So that's chapter 2 for you. It's super simple and easy. Just page 29. We're now going to switch gears and talk about chapter 31. So chapter 31 will focus on the urinalysis system, which does deal with nephrology. Some of the organs that are in the urinalysis system are kidneys, ureters, bladder, and urethra. So let's take a closer look at each of those. So your kidneys are 2 bean-shaped organs located at the back of your abdominal cavity. The kidneys have both internal and external parts. The external structure of your kidney is also called the hilum. This is the opening for where the ureter will actually connect to the renal pelvis that will collect the urine. The internal parts of your kidney are separated by your renal cortex, which is a soft, dense, and considered the outer layer of your kidney, the outer inner layer of your kidney, and the renal medulla. And the renal medulla is found deep within your kidney, and it forms little renal pyramids. So if you cut open a kidney and looked at it, you would see little pyramids on the inside. Now, when we talk about a kidney, there's one other key part to the kidneys, and that is the nephron. Now, a nephron is the functional unit of your kidney, and there are over 1 million nephrons in each kidney, so about 2 million within your body. Ureters are the next thing that we're going to talk about, and they are 2 muscular tubes that carry newly formed urine from each of your kidneys down to the bladder. Now, each ureter is about 8 to 12 inches in length, and they will come out of the kidneys in the back. Your bladder, which is now going to take that urine, is a hollow muscular sac that is used to reserve or hold the urine. Your bladder is found in your pelvic cavity, and that bladder can actually hold a great deal of liquid. It can hold up to 500 milliliters of urine, but you will feel the need to actually void and clear your bladder when it's about 300 to 350 milliliters full. On average, human beings will void about 1,000 to 1,500 milliliters of urine daily. It's a lot of urine when you think about it. And the last body part that we're going to talk about here is going to be the urethra. Now, this is a tube of muscle and membrane that's responsible for actually voiding or exiting the urine. This urethra will extend from the bladder to the urinary meatus, which is the opening of the genitalia. Now, in men, it's about 7 inches long, and for women, our urethra is only about 1.2 inches long. So we don't have as long of a urethra as males do. Now, when we talk about these systems and the structures within the systems, those are important, but we also need to talk about the production of urine. So the formation of urine can be divided into 3 parts: the filtration, reabsorption, and secretion. Now, urine is made up and consists of about 95% water and then 5% solid fluids or solid substances. Normal urine should be clear in color, or should be clear so you can see through it, and have a straw yellow color to it, so a pale yellow. Alright, and the last thing that I really want to talk about for this chapter is some of the common disorders that you might encounter or hear while working in a nephrology office or a urinalysis office. Goodness, I'll get my words out, I promise. So the first disease that you might encounter is a kidney stone. Now, kidney stones are formed when urine contains too much of a certain substance. They are found while still in the kidney, generally, but should pass through your ureter naturally. But what will happen is it will slow or block your urine flow. If a patient does have a kidney stone, they're usually going to have some severe or intense lower back pain right about where your kidneys are. They could have nausea or vomiting, and they could have a decrease in their urine output. To treat a kidney stone, you generally just have the patient pass it on their own. But if that stone is too large to actually pass on your own, you will have a surgical procedure completed, which is called lithotripsy. And what happens is, during lithotripsy, they use shock waves that pass through your body to break that stone up. Once it's small enough, then the patient will have to pass it on their own. Another disease that you might deal with is polycystic kidney disease, or PKD. This is a disorder which multiple clusters of cysts develop, generally within the surface of your kidney. These cysts are typically benign, which means they are non-cancerous. And if a patient does have polycystic kidney disease, they will have high blood pressure, back or side pain, abdominal pain. They'll also have an increase of their abdomen, which will look like bloating. They'll have blood in their urine. They could have kidney failure or kidney infections, and typically will have headaches. In order to treat this disease, it involves controlling the symptoms, so talking about the blood pressure and the pain, and hopefully the swelling in the abdomen. And the cyst will need to be drained during a surgical procedure. Now, sadly, because there are several cysts that show up during polycystic kidney disease, this can never fully be completely removed, so the cysts will keep coming back. Another disease that you might deal with is called a UTI, or a urinary tract infection. This is where bacteria or viruses can cause an infection, but the most common disease bacteria that will cause this is E. coli. patient presents with symptoms of a UTI, they will have back, side, or groin pain. They'll have the urgency to urinate frequently, or they will be urinating frequently. They can have pain or burning when they do void. They can have a fever with chills, nausea, and vomiting. And they could possibly have some blood in the urine. Now, to treat a UTI, we generally prescribe the patient antibiotics, and they should be good within about a week. Incontinence is another disorder that you will deal with in the urological and nephrology departments. This is an involuntary and unpredictable flow of urine. Most commonly, we'll see this in women after they've had a child or gone through childbirth. Treatment for incontinence would be medications to relax the bladder wall and reduce the overactive contractions. You could have surgery or do Kegel exercises. Glomerulonephritis is another type of disease that you will hear. It's also just called glomerular disease. And this is where you have an inflammation of the kidneys, primarily in the glomerule. Some signs and symptoms you might see will include urine that is dark amber in color, a foam in the toilet after voiding, high blood pressure. They could be fatigued or severely tired, joint or muscle pains, swelling or edema in the face, hands, feet, and then they'll have abdominal pain and diarrhea. In order to treat this condition, we use steroids to reduce the inflammation in the stomach and other places. And then we'll do some dietary changes to limit your sodium intake, your fluid intake, and your protein intake. Cystitis is another disease that you'll hear. This is an inflammation of your bladder that is normally caused by ascending UTIs. Some of the signs and symptoms are the urgency and frequency to void or use the restroom. You'll have some itching or dysuria, which is painful urination. You'll have dark, cloudy, or bloody urine, and a foul smell to the odor, or a foul odor to your urine. In order to treat cystitis, we will give a patient antibiotics. And the last disease that you might deal with is renal failure. This is a condition where the kidneys will cease to function properly. And there are two types of renal failure. We have acute renal failure and chronic renal failure. Acute renal failure will occur when there are changes in the filtering function of your kidneys. What will happen is it will impair the kidney's ability to maintain a normal function. And if a patient does have acute renal failure, there are no immediate signs or symptoms, but over time their urine output will be decreased. They'll have irregular heartbeats, and they'll have swelling in the abdomen or extremities. To treat acute renal failure, patients can have dialysis, which will use a filter other than their kidneys to remove the toxins and maintain water balance. Now, chronic renal failure, on the other hand, is a gradual and progressive loss of the kidney functions that transpire over the course of months to over the course of years. The early signs and symptoms of chronic renal failure are fatigue, which is extreme tiredness, headaches, itchy or dry scalp, nausea, and weight loss. If a patient has end-stage renal failure, they will have some signs and symptoms that include changes in the color to their skin, generally a yellowing in color, bone or nervous system damages. They'll have bone pain or joint pain, excessive thirst, they'll have frequent hiccups, and a low sex drive. Treatment for either type of chronic kidney disease, either end stage or early stage, would be treatment with hemodialysis or peritoneal dialysis. Alright, this is where I'm going to stop for this week's video and these week's overviews. As always, I encourage you to read your chapters in full, as it will help guide you in your discussion posts and your online quiz. Also, reading the chapters will help you be prepared for your lab class and knowing the materials that you will be completing while in there. Your discussion board this week is talking about what can destroy your kidneys. You will need to do some research, both online and in your book, to find out what does destroy the kidneys. You need to talk about, could it be medications? And if so, what are the medications that it could be? Could your kidneys be destroyed by chemicals? And again, if so, what chemicals? But you also need to think about, are there any genetic disorders or hereditary diseases that could cause damage to the kidneys? Once you discuss what can destroy your kidneys, you'll need to discuss whether there is something that we can do now to take better care of our kidneys and protect them from this future damage. Please remember that your initial discussion post is due Tuesday by midnight, and you need to have 2 responses to classmates Saturday by midnight. Lastly, I want to talk about your quiz for this week, which is going to be over Chapter 2, page 29, and Chapter 31. Your quiz is a 10-question multiple-choice true-false quiz with a 10-minute time limit. With that being said, that means that it is due Sunday by midnight. If you guys have any questions, concerns, comments, or you need to reach out for a little bit of extra help, please make sure that you're doing so. I'm always available to help you guys as much as I possibly can. Have a wonderful week, guys. Bye-bye.